For generations, Native Americans have served in the U.S. military at higher rates than most.
Today, some 150,000 people who identify as Indigenous are veterans of the armed services. Yet many of these veterans struggle to access the health care they need.
Cronkite News reporter Gabrielle Olivera went to the HOPI tribe's reservation and spoke with veterans there to better understand the obstacles they're facing.
The veterans we spoke with mentioned a lack of services actually present on the reservation and how difficult it is to travel long distances to get the medical care they need.
Jacket zipped, helmet on, and American bandana showing the pride Clifford Bolinkwa feels as a United States veteran. The Hopi tribesman loves to ride his motorcycle on the reservation, which stretches more than 2,500 square miles. Over 9,000 Hopi live here, and many of them are also veterans. Serving in the military is an experience Clifford recalls both with pride and anguish.
I can't help but think about my time in the service and to think about if I had never gone to Vietnam, I probably would have never been like this. So even at my old age, and I'm 74, it bothers me.
The Hopi culture is considered a peaceful one, and so processing the trauma of war has not been easy for Bolinkwa and others like him.
Like for years and years, and even now, when I'm driving down the road, I see a dead dog on the side of the road or a dead animal, I think about Vietnamese children that are, or Vietnamese people that are killed, laying there.
Decades after Vietnam, Bolinkwa is still struggling with anxiety, depression, and PTSD. But what frustrates him and other Native veterans most are roadblocks they say prevent them from getting the services they're entitled to. A lack of easy access to health care and an absence of culturally appropriate care are pressing issues experts say the federal government needs to fix.
American Indians and Alaska Natives have the highest poverty rate and the highest uninsured rate. This seems out of balance. We serve, we protect, but yet we struggle to have parity in the system.
Congress is considering legislation that, if implemented, would help Native veterans in urban areas access more services, but challenges remain for those living on reservations. Native American veterans do have access to Indian health services, but for more specialized care, they're usually forced to travel for hours to one of the 3 VA hospitals in the state. For example, the Hopi Nation to the Phoenix VA is 234 miles. It's a long trek for veterans like Vanessa Barnes-Suedo, who served in Afghanistan from 2008 to 2014. Once she returned from combat, she says she thought she would have easier access to medical resources through Veterans Affairs. However, that hasn't been the case.
And they kept pushing me to be a part of the service units that are out here, but they're only used through telecom and webcam, and I prefer face-to-face.
The VA says all these issues are complex.
They are trying to seek their own healing in their own way, and I think the Veterans Administration is responding and looking into that as well.
Someone who is trying to help is EUGENE TALAS, who served in the Air Force for 30 years. He's part of the HOPI Veteran Services program on the reservation.
The ones I'm trying to work with is to get maybe the mental health, the PTS, post-traumatic stress disorder, group counseling sessions here on HOPI. I think that needs to be strengthened up for all our combat war veterans that are facing those type of issues, whether it's mental health, post-traumatic stress disorder, even that might lead into other social issues.
You can't run down the street to see a mental health therapist, you know. So there's a lot to be desired on Indian reservations.
There's an Office of Rural Health within the VA to help address issues affecting veterans in remote areas or on tribal land. That office has 5 health resource centers, none of which are in Arizona. Live in the Broadcast Center, Gabrielle Olivera, Cronkite News.